everyone, how are you? I hope you are all doing okay, and we are in the weekend. It's a nice weather, not too bad. So today I had a theater list, and I actually wanted to speak to you about one of a couple of interesting cases that I found today. One of them is for a young lady, and she had a history of vaginal pain and problem with the urines and all of these things. So I've offered her 6 sessions of lidocaine infusions in a row over about 6 months, and also I have done today some nerve blocks for the vaginal pain. Surprisingly, and what I wanted to tell you is, I found actually during examination today under x-rays that she has a tailbone issues, which is the coccyx, and this is a really highly associated issue with the vaginal pain and pelvic pain. A lot of women might not realize that they have a tailbone issues, and they don't know that they have a coccyx pain except when somebody press on it. But I wanted to highlight this to all of you. If you have a problem when you sit down for a long time, or driving is causing more pelvic pain problems, it could be actually related to the coccyx, and coccyx injection, among other things that I offer, will be very useful. So you might ask me why lidocaine infusion is necessary in pelvic pain treatment. I actually offer lidocaine for 2 important pain problems. One of them is pelvic pain, and one of them is resistant headaches, because these are 2 of the most resistant pain problems. It takes a lot of time. There is something called hypersensitivity at the spinal cord level and at the brain level. Also, there is a problem with, we don't know the origin of the headache or origin of the pelvic pain. I will talk about headache later on when I have a headache case, and I actually had today, but it will be too much talk about headache if I put 2 together. So lidocaine infusion is very important to block the central hypersensitivity and the brain memory of pain. So for this lady, I offered her today injection for the vaginal pain, but interestingly, I found she had a coccyx pain as well, and she wasn't aware that it is coming from the coccyx as well. And if we dig more, I found also when I asked about urine problems. So if you have urgency, if you cannot hold the urine until you go to the toilet, if you find the small amount of urine irritates your bladder, if you have pain above the pubic area, it's most probably something we call interstitial cystitis. And this is what I found with this lady, because all her cystoscopies and all investigations back as normal, but from the symptoms and when it combined with vaginal pain and pelvic pain, it is a very common association to have interstitial cystitis. And for this, I do a specific sacral nerve root block. Usually patients get very good relief, but it takes about at least 6 months to 8 months to get that relief, because it needs patience, and that's what I want to educate all of you. So this video is awareness and education about the pelvic pain. You need to be patient with your doctor when you have treatment for pelvic pain, because it has so many territories and so many origins. But my job is really to dig deep into the origin and get the cause sorted before we start the second stage of the treatment, which is plasma-rich platelets, and which I'm going to explain in a different video. Thank you so much for watching me today, and see you in the next video. Goodbye.